if you're someone who is really into learning, I think this video is for you.
I spent a few days at the American Academy of Audiology convention in New Orleans, and as I went there, I had the question, how do I say the name of the city? And I was polling people and asking people. What was very interesting is I was there in New Orleans. Most of the locals say New Orleans.
Oh.
But every once in a while, they'll bring out the New Orleans.
Oh.
The Pelicans and Warriors were playing a game, and right there at the arena they said, home of your New Orleans Pelicans.
So, see, and I didn't think that, because maybe I watched too much TV.
I know.
And you hear the slang, you know, Narlands.
Man, Narlands, yeah. I didn't hear any Narlands. I was a little disappointed.
I wonder.
I know. But now I'm sure different people could go to this convention and get different takeaways than me. But my personal 3 takeaways. Number 1, artificial intelligence and deep neural networks are the future of hearing aids.
I agree.
That's number 1. Number 2.
Huge.
Number 2, takeaway number 2 is our profession, audiology, is more than just hearing aids. We'll expand on that a little bit.
Okay.
And number 3, what stood out to me, what was not talked about very much this year, which has been a hot topic the last couple of years, is over-the-counter OTC devices. That stood out to me this year.
Interesting. So AI. You know, AI is this ability to sense what's happening around you and make decisions without you having to do anything. It's making decisions based on noise floor. It's making decisions on speech, not just normal speech, but the frequency of speech, male, female, language, the different languages and accents. AI takes into account all manner of different types of speech. And so it's really neat, but it also is trying to find the noise. It's trying to find where the noise is and what can be done with this beamforming technology and how to really go after the noise to try to suppress it in efforts to bring the speech up. And so the idea is if we can get the speech higher and the noise lower, giving a better kind of a speech index where we can really have good intelligibility, really understand the speech, then people are more successful with hearing devices.
And this isn't anything new. Machine learning, machine decision making's been around a while. Artificial intelligence, in a sense, has been around a while. But the old type of artificial intelligence was decision making, where you would teach the device, you'd teach the machine certain rules to follow. It was likened at this conference. One of the presenters said, you know, the old artificial intelligence is like if you're teaching a student and you're teaching them the basics, you teach them 10 rules. You say, if you see this, you do this.
That's right.
If you see this, then you do this. You give them just hard and fast rules. Whereas the new type of artificial intelligence gets into this deep neural network, it's more sophisticated learning. The new stuff is more like if you're an expert in the field, you've read an entire textbook. Not only have you read it, you understand the nuances of how different things work, instead of just a hard and fast rule of if I see this, I do this.
That's right.
Now you're taking into account some of the more intricate details as you're making decisions. It's just much more nuanced and sophisticated. That's what we're talking about when we're talking deep neural networks.
It's exciting. So no wonder it got so much attention, because if you can wear a hearing device that has pre-programmed into this deep neural network, you know, anywhere from 1 to 3 billion types of, you know, different sound environments, different language, different, you know, all different types of scenarios as it relates to speech and noise, you're going to have a much better experience with your hearing device.
They're just better. So, these deep neural networks, you know, for someone watching thinking, well, what does this mean? It means better hearing and background noise. That's right. What it means. The device is better able to differentiate between wanted sounds, unwanted sounds. It's better able to suppress the unwanted sounds, and it's just getting so good at making those decisions.
It's amazing. So that's exciting.
That's exciting. And
so takeaway 1 is AI and deep neural network deserves a lot of attention. I think we're going to be hearing a lot more of this, and I think it's going to get better and better as the years go on.
Absolutely. Sure. Even on our channel, we've been talking about this for a while. This isn't a surprise. The biggest manufacturers in the hearing aid world were all at this convention. Phonak was there. They've got this Infinio Sphere using the AI. Starkey was there. They've got the Edge AI. They've got Resound, I should say, was there. Resound, a huge. Vivia. They've got the Vivia. Oticon was there. They have the Intent. Those are probably the 4 biggest hearing aids out right now that are incorporating this AI and deep neural network.
Yeah, and they deserve a lot of attention. our patients who are trying these devices are actually having a phenomenal experience with them.
Yeah.
So the good news is there's a lot of hype, but it's kind of warranted because the individuals that are wearing the devices are coming back saying, this sounds so much easier, it's so much easier to understand speech when I'm in certain environments. I love this new device that I recently am trying out. So the research is ongoing. We so appreciate it, but no question that AI, deep neural network, deserves a lot of attention. No wonder it was a hot topic.
That was number one. That's what stood out to me. Number two, that second topic?
Number two is an important one because with all this talk of technology and how exciting technology is, oftentimes we leave the patient kind of in the background and we let the hearing device take the forefront as if it's going to solve all the problems. But that's just not the case.
That's not true. Our profession is more than just hearing aids. It's more than just technology. That tool is pretty neat.
Yeah.
But that tool, if it's not used properly, if a patient isn't fitted properly, and if they're not getting good counseling, we call this aural rehabilitation.
That's right.
If the audiologist isn't helping you on your journey, if the audiologist isn't helping you understand what you're going through as you're adapting to sounds and adapting to hearing aid, it's like a physical therapist that helping someone to rehabilitate a joint. We are rehabilitating the auditory system, and as audiologists, that's a big part of what we do.
It's a big part, and it's such a big part that when we fit hearing devices here at the Hearing and Balance Doctors Clinic, we oftentimes say we're going to need 4 to 5 visits in your first 2 months. That's how important those first 2 months are in helping someone get off and make sure their journey is going in the right direction. It starts with physical fit. It starts with them understanding different listening environments. I mean, when you have a knee or a shoulder replaced and it's not working well, and so you go in for surgery, maybe your shoulder hasn't been working well for years, and it's slowly getting worse, and then all of a sudden you get a new shoulder. The rehab process takes about 6 months just to get that range of motion where you can finally get your arm above your head and things are starting to loosen up. Well, it turns out that when you just shock your brain with new sound that's much bigger, much more robust, much more full and complete, your brain kind of has that moment of, this is really hard. And so getting your brain used to sound, getting your body used to something being in your ear and things like that, aural rehab is a very, very important piece. So the idea of buying a hearing device or trying to implement a hearing treatment plan for you and just thinking, I'm going to love this on day one, it turns out that yes, you'll be healthier, yes, you'll be stronger, yes, you'll feel more complete, but it doesn't mean that there's not some rough edges along the way.
Absolutely. That was my thought too. There's so much talk about direct-to-consumer hearing aids. Let's buy something off the internet. Let's get something out of a TV ad.
I mean, there's TV ads, there's
magazines,
there's eBay.
Yeah.
There's lots of places where stories we hear where people say, yeah, I bought this off the TV or whatever. And man, have I been super disappointed. And oftentimes it's not the device.
Yeah, because what's the missing component? They're missing the aural rehab. If you just have the device with no rehab, no coach, no cheerleader, no one there helping you understand the process, no one making sure that it's done appropriately and correctly, you're setting yourself up to fail. And as audiologists, we lose sight of that sometimes. We get so excited about AI and deep neural networks and technology that we lose sight of, man, that tool alone is not enough.
That's right.
Our profession is more than just the tool. We help people rehabilitate their auditory system and get back into hearing better.
Most clinics that are professionals, like our clinic, that have doctors of audiology, they don't just have, let's see how you're doing for 2 months. It's typically a 6-month window where we're doing very specific things with the patient for follow-up along the way during a 6-month period, just to ensure that they're as healthy, as happy, as successful as they can be, to make sure that they're getting the right stimulation to the brain, to make sure they're maintaining those areas of the brain, make sure they're connecting with their family the way they ought to, and then to just personally go through each listening environment with them and keep setting goals, keep trying to do better and better in very specific listening environments. I mean, everyone wants to progress. And so progress leads to so much energy and so much excitement. And that effort that we put in through aural rehab, it really gives the patient a lot of momentum where they can do much, much better.
Yeah, our profession is more. Audiology is more than just hearing aids. Audiologists are more than just hearing aid salesmen. If it's being done the right way, it is much, much more than that. One final thought, in our profession being more than just instruments, part of that is also there are actually a lot of audiologists, and I ran into many of them at this conference, that don't even do hearing aids. Our profession is more than hearing aids. I talked to some of my colleagues. I talked to one actually in the airport.
That's right.
And she works strictly in hospitals, strictly with newborns, strictly doing neurophysiologic testing to assess newborns' hearing at birth. She never sees hearing aids.
You know, and we have audiology professionals that work in academia.
Yes.
So they're in this academic setting, the universities, and they're doing research, and they're involving their students in the hearing science research. And so they're teaching and they're doing research and they're in academia.
I had another colleague that I ran into. All she does is tinnitus counseling. Her entire practice is centered around tinnitus management.
Yeah.
That was fascinating. She does a little bit with hearing aids because sometimes the devices are part of the treatment, but it's actually a very small part of her practice.
And then we have clinicians. You know, our clinic's kind of a hybrid clinic where we do a lot of vestibular or balance testing, but there are audiologists, and we know several centers across the United States where all they do all day long is treat and manage dizziness and balance patients. And so, you know, there's those type of audiologists as well.
Yeah, we are more than just hearing aids.
And one of the specialties you have and that we've enjoyed here at our clinic too is the intraoperative monitoring.
That's right. That is getting off a little bit. You'd think, how in the world does this relate to the ears? Intraoperative monitoring is the idea that during surgery you monitor the nerves so that when the patient wakes up, they can still move their arms and legs. Yeah. I had the opportunity to do that for several years with cervical spine surgeries.
So spine surgeries, even brain surgeries, tumor surgeries. Individuals that are audiologists, doctors of audiology, some of our colleagues are specialists in this intraoperative monitoring specialty.
Yeah, so we're more than just hearing aids. Third point that stood out is what was not mentioned. Over-the-counter devices were conspicuously absent at the American Academy of Audiology, which is different than it's been the last couple of years.
That's right. Over-the-counter hearing devices have been really, really the buzz, and a buzz term and a topic that we've heard a lot about ever since 2022. In fact, 1 year prior to 2022, before the law went into, was enacted and OTC hearing devices were finally available and legal, we were hearing a lot of kind of excitement around this over-the-counter hearing stuff. This idea that someone who thinks they might have some hearing loss could take a test on their phone. They could go into a quiet room and take a little hearing test, or maybe they've been to an audiologist like us and they found out that they have hearing loss. They could go to a Best Buy location or maybe online and purchase an over-the-counter hearing device.
Yeah, and this has got so much publicity and so much talk, and at our conferences, we've gone to previous conferences, and there was almost a little bit of fear of what's going to happen. As these over-the-counter devices come out, are audiologists obsolete? Are we going away? And what we've found, and as time has gone on, that no, like we just talked about, we are more than devices as audiologists. Right. And it turns out that these over-the-counter devices that are direct to consumer, they haven't taken hold maybe quite as much as people anticipated they would.
Not at all. In fact, it has been a complete flop. It's been one of the most, because we were hoping that it would be fairly successful. The idea of people getting help sooner is actually really good for health. So as doctors, we were thinking people are thinking about their hearing more, they're going to go do something. I mean, it's a really positive thing, but individuals that have tried the over-the-counter devices, if they're trying them at all, for some reason, they're just not taking off. Even for people with mild hearing loss that you think it would be a perfect idea, they just don't want to wear them.
And we hope some people are succeeding. We're sure some people are. But just in general, when you look at the entire population of the United States and the world, it just really hasn't caught on like we thought it might. And so conspicuously absent from the American Academy of Audiology conference was discussion and even talk about these over-the-counter devices.
Yeah, so much talk early on. And now to think, here you are at the largest conference that is for and by audiologists. It's for people like us to do our very best work. You would think that over-the-counter OTC hearing devices would still be, a topic that we should be addressing and learning about, and how can we help? And it is now absent. I mean, it just shows you that it just did not take off.
Yeah, so really good takeaways from this year's conference. It was really exciting to be there. My first time in New Orleans was so wonderful. The education was out of this world. The food was out of this world.
I was going to ask you, speaking of learning and thinking of topics that are kind of spicy.
I was educated. I was educated in the spicy foods, the Cajun, the Creole. New Orleans was so much fun. Thank you for hosting this year, New Orleans, and thank you to the American Academy of Audiology for putting on such a great event.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.